Thank you, President. My question is for the Minister representing the Minister for Health. What is this government's COVID-19 serology surveillance strategy? Victoria must have a strategy for conducting antibody testing of its population so that we can understand the true prevalence and risks of SARS-CoV-2 in the Victorian population. Where other countries have conducted this testing, it has been shown that infection rates were more than 20 times higher than previously thought. This correspondingly informed evidence-based policy. Such a strategy doesn't need to be perfect, it just needs to be sound. Without serology-based antibody testing, we cannot answer critical questions like how effective was the government's swab testing regime, how much of the Victorian population has been infected with the virus causing COVID-19, how is this changing over time, are there different characteristics or risk factors that are associated with SARS-CoV-2 infection, such as age, location or underlying health conditions, how many Victorian residents experience mild or asymptomatic COVID-19 illness, and how long can antibodies be found after a COVID-19 infection? In the absence of a serological testing regime, what is the government's current estimate of the number of Victorians who have contracted COVID up to this date? The public cannot have confidence that the government is implementing coronavirus suppression strategies in their interest when they're denied information about the virus's serological characteristics. In the early days of the pandemic, it was understandable that the public service would focus on the short-term containment of the virus, but as the crisis drags on, it becomes harder and harder to give the government a pass for not confirming basic facts and assumptions about the virus. My question for the Minister is this: if the government hasn't taken steps to develop a sound understanding of the virus characteristics in the Victorian population, how can Victorians have confidence that the government is managing its COVID response in line with evidence risk-based management?